What's up, y'all? It's Celeste. I had double incision top surgery with Dr. Garramone on October 10th, 2017, and I also had a very minor revision on November 7th, 2018. So at this point, I am now just a little bit over a year and a half post-op from my original surgery and about 6 months post-op from the revision. I don't have a whole lot to show you or talk about at this point because I really don't have to do much special with my chest anymore. But I did want to just give you a little sort of visual update just for those who are following along if you're planning to have top surgery or if you've had top surgery and are thinking about getting a revision or whatnot. This is for you. This is just like a little update about how things are, especially with the revision, because I haven't really shown too much of that or talked too much about that since I had it done or shortly after I had it done. So here you go, here's my chest. So here I am at a year and a half post-op. I don't think I look a whole lot different here than I did at a year post-op, but I think my scars are maybe a tiny bit lighter, maybe a little bit closer to the rest of my skin color as opposed to a little bit pinkish. They're still slightly pinkish, but maybe a little bit less so. I think they're maybe a little bit smoother as well. If I kind of press down as I go across here, I can feel that there's a difference in that part of the skin. I can feel that there's a scar under there, but just lightly stroking, I really can't feel pretty much any difference at all. This whole thing feels completely smooth. Over on this side in the middle, there's a little bit more thickness, but even that is really pretty smooth, especially compared to how it was for the first several months post-op. Over here is where I had my revision done. As you can see, it is healed really well. I actually didn't do any kind of scar care on this at all. I didn't do any massaging, didn't do any oil, no silicone strips, absolutely nothing whatsoever. Didn't even moisturize it or anything, partly because I didn't feel like it really needed it, and partly because I was kind of curious to see how it would compare in healing to the rest of my incisions. Obviously, it's not an exact comparison because, first of all, the amount of trauma that was done here is very, very minimal compared to how it was here. Also, like, when I stretch here, like, it does move this area, it does pull at this area, but compared to, like, the whole rest of my chest and the amount of movement that I do and stuff, there's just not as much kind of force in that area to kind of stretch the scar or anything. So, like I said, not an exact comparison, but still, for not doing anything at all, I'm really happy with how this is healing and how it's healed pretty much. It's pretty much already healed. It just needs to lighten a little bit, but that's basically it. My nipple grafts still look good. I do still moisturize them just with regular moisturizing lotion, the same stuff that I use on my face and other parts of my body. Just every day I just put a little bit on there and kind of rub it in. That's it. And I'm really happy with them. I don't think that they have really changed much since a year. I don't know that they've gotten any darker or if the projection has changed. I don't think it really has. I'm happy with that. I don't really want it to change. So yeah, that's pretty much it here. So once again, here's a final look at my chest, a year and a half post-op. So that's pretty much it. As always, if you have any questions or comments, leave them below. And if you like this video, give it a thumbs up. Subscribe to see more of my future content and hit that notification bell so you don't miss anything. Thank you so much for watching, and I'll see you next time.